Welcome back. A very important meeting will take place this week, and what's decided there could have a very big impact on your health decisions. The CDC's Advisory Committee on Immunization Practices, meets 3 times a year. Now, its next meeting runs this Wednesday through Friday. The committee will be voting on recommendations for 5 different vaccines already approved by the FDA, including COVID-19 and the flu for adults and children. Among other things, those recommendations, or lack thereof, carry a lot of weight with insurance carriers. This week's meeting is the first since Health and Human Services Secretary RFK Jr. replaced all 17 members of the committee just 2 weeks ago. He replaced them with 8 people, many of whom are vaccine skeptics. And we're joined now by Dr. John Temte. He is a professor of family medicine and community health at the UW School of Medicine and Public Health. He is also the chair of the Wisconsin Council on Immunization Practices. So, Doctor, let's start with it. The 17 removed committee members came out last week and with a statement in an op-ed piece, and they said that this decision has left the U.S. vaccine program critically weakened. The chair of the Infectious Disease Committee for the American Academy of Pediatrics called this an unmitigated public health disaster. Very strong words. What was your reaction to this move?
My first reaction was one of profound sadness. For somebody who has spent a long time affiliated with the Advisory Committee on Immunization Practices, this is a committee that has global prominence and global respect, and it had that respect for the past 61 years. So this is a dramatic change that we did not see coming. There were assurances that wasn't going to happen, and in its wake, I think it really leaves a lot of concern amongst medical and public health professionals.
You're chair, as I mentioned, you're chair of the Wisconsin version of this committee. So if this were to happen to your committee, where every single member was replaced in one fell swoop, what kind of impact would that have?
Well, I think more than anything, it has a huge impact on the trust of the constituent groups out there that rely on evidence-based recommendations for immunization practice. I think you led off with a comment from the American Academy of Pediatrics, but the American Academy of Family Physicians, the American Academy of Pediatrics, the American Academy, or the American College of Physicians have all come out with incredibly strong statements expressing their outrage, their shock, and their disappointment with this move.
Let's talk about the practical effects of this move. How critical is an ACIP recommendation for a vaccine, and does that trickle down to state, perhaps local regulations, or even what your board does?
Yeah, absolutely. I'm going to start at the level of a physician or another clinician and a patient. And anything that's done that diminishes the trust in a vaccine recommendation really impacts that clinician-patient interaction, that relationship. We rely on really high levels of good quality evidence to make our recommendations to assure both the effectiveness of vaccines, but more importantly, the safety. And our vaccine enterprises had unprecedented safety and enormous benefit across the population. When we start looking further up, decisions by the Advisory Committee on Immunization Practices have a bearing on the coverage by insurance companies. It has a bearing on the coverage of vaccines for children through the Vaccine for Children program that supplies vaccine at no cost for coverage of more than 50% of our children as they are living in poverty.
Since you touched on children's vaccines, I want to bring this comment up. Secretary Kennedy told ABC News that he wants this new ACIP to reanalyze vaccine recommendations that have previously been made for children because he doesn't trust the science leading to their approval. What's your reaction to that?
I would argue that this has been settled science for a very long time. The Congress had asked the Institute of Medicine to conduct an evaluation of the safety of the entire pediatric schedule. These are all the vaccines that children receive between birth and age 18. The conclusion is there is no concern of the safety when we adhere to this vaccine schedule. So we're debating what we would consider settled science, investing time and effort where it does need to be invested when we still have critical public health issues that need to be dealt with seriously and competently.
Let's go to tangible things that parents and patients now have to weigh. So if a vaccine is approved by the FDA but does not receive the approval or the recommendation, of the ACIP and ultimately the CDC director, they have the final say on this. What will parents and patients have to weigh in their decision on a vaccine?
Well, any vaccine that has been approved and licensed by the FDA can be given to a patient by any physician. We don't need the ACIP recommendation. But what the recommendation brings in is the assurance that a vaccine has been studied in large populations and has been shown to be effective in terms of prevention of illness and safe in terms of general use. And so when we step away from that, we make it more difficult for that conversation to occur between clinicians and patients, between doctors and parents, and so on. And at the end of the day, we diminish the likelihood that people receive vaccines. And I'll just mention that in our state of Wisconsin last year, we had 3 children die of influenza, and none of them were immunized. And we know that immunization for influenza has a very, very strong likelihood of preventing death in a child. And so these are things that aren't only theoretically an issue, but are on that really intensely personal level as well.
You mentioned influenza. That is one of the vaccines that will be discussed and recommended at the meeting coming up this week. We acknowledge some people have the right to choose whether or not they want to be vaccinated. Some people certainly can choose to not be vaccinated. That is their right. But with this debate swirling right now, for those who want to be vaccinated, what's your advice for who is the best person to trust on making that decision?
Time and time again, this has come up, and the individual who is most trusted by a patient for a vaccine recommendation is their own physician, nurse practitioner, physician assistant, the person that they have a relationship with in that clinical space that can provide that trusted recommendation.
Terrific. Dr. Temte, thanks so much for taking the time. We really appreciate the insight.
Well, and thank you for giving some time to this very, very important topic.